Welcome to Neuro PT Now Educational Series. This is Dr. Katrina Banks, neurologic physical therapist. Today I will be talking about cortical basal degeneration, which is another atypical Parkinsonism. Just a quick disclaimer that any information I am providing is for educational purposes only. Always communicate with medical professionals such as your primary care, nurse practitioner, physician assistant, and physical therapist for any further advice or treatment. All right, so cortical basal degeneration. Again, in a typical Parkinsonism, it is due to an atrophy of your brain. So the cerebral atrophy, so this is a normal brain, and then atrophy of this brain just means it's shrunk a little bit. But it affects there's a shrinkage of the parietal cortex area of the brain that helps us with our sense of touch and limb position. And also it affects the substantia nigra area of the brain where dopamine is produced, and the dopaminergic neurons help with facilitation of movement. The progression is very slow and gradual. Symptoms usually occur around age 60, and most likely you'll see walking impairments and early postural impairments, means loss of balance fairly soon. So let's get into the signs and symptoms. So another big factor to consider with cortical basal degeneration is eye movement limitation. So you will see a limitation in moving your eyes left to right, or in a horizontal position, or upward. So looking up. You'll also see ideomotor and ideational apraxia, which means you're unable to make purposeful movements. For example, like combing your hair or brushing your teeth. You may see early and progressive dementia. You may have stereoagnosis, which is the inability to identify an object by touch, and also agraphesthesia, which is difficulty recognizing a written number or letter when traced on your skin. And you may also find that these individuals have neglect, so they completely ignore one side of the body completely. So how does physical therapy play a role? No big surprise, exercise, of course, is key in keeping these individuals functioning and keep them going. We want to prevent contractures of the joint. You may have tightness of the joints, and we want to make sure that we try to prevent that. We want to make tasks as simple as possible. We don't want to overwhelm the individual with teaching them new things. And we want to promote symmetry, because again, they may neglect that one side of their body, and we have to retrain the brain a bit to make sure that the person is aware of what's happening around them. All right, so that's it for that. Very short and sweet on cortical basal degeneration. Thank you for listening. If you have any questions, please reach out. And also, please follow me on YouTube at Neuro PT Now Educational Series. Thank you.